with my degree. Um, sorry, I'll start again. So good evening and welcome to what I did with my degree, presented by the CUNY SPH Office of Career Services. My name is Elena Gonzalez, and I'm a Master's of Public Health student in the Community Health concentration, and I'm in the Career Skills Academy, as well as the Secretary of the Queer and Trans Health Justice Network. I am joined by our co-moderator for the evening, Chelese, who will be engaging with you all in the chat.
Hello, everyone. My name is Chelese Moore. I am a CUNY SPH MPH student with a degree with a concentration in community health and graduating in spring of 2027. I am a Career Skills Academy student as well as an APA scholar.
Okay, tonight we will hear from public health professionals who are CUNY SPH alumni and hold a Master of Public Health degree in community health. They will speak to us about their professional experiences and share valuable tips and takeaways. Before we begin the panel, I want to give a brief description of the degree program. The MPH and Community Health program prepares students to promote health in urban communities using social and behavioral sciences. For more information on this degree program and others offered at CUNY SPH, you can visit the link that Chelese will share in the chat. Tonight's panel will include moderated questions for our panelists and a Q&A segment where the panelists will get to hear from you all directly. As a reminder, you are able to visit the other breakout rooms at any time. Until we reach the Q&A segment, please use the chat for your questions and comments. Now let's hear from our panelists. So good evening, panelists. I'm so excited to speak with you all tonight. I really look forward to hearing more about your experiences as CUNY SPH alumni and public health professionals. To get started, will each of you please introduce yourselves to the audience?
Hi, good evening, everybody. My name is Annette. I got my master's in public health and community health in last year, spring 2024. I'm currently the Deputy Director of Procedure Development in the Office of Procedure Development and Implementation at the New York City Department of Homeless Services. And my team and I oversee all policies and procedures for Department of Homeless Services. I don't want to say DHS, not the other one. We are responsible for writing and revising all the policies that govern the DHS facilities, staff, and providers, and where I get all the subject matter experts together, draft something up, and make sure that everybody's good with it. But yeah, happy to be here with everyone.
I think I'm next. Hi, everybody. My name is Caroline Praderio. I use she, her pronouns. I also have an MPH with the community health concentration, and I graduated in spring of 2025. So just this year. Currently, I'm the Director of Institutional Funding at Planned Parenthood of Greater New York. I would probably say PPGNY as I'm talking about working there. So that's the acronym we use. And for those who aren't familiar, PPGNY is a sexual and reproductive healthcare organization that serves 30 counties across New York State. So I'm in a fundraising role, and the work is basically divided into two buckets. One is I secure grant funding from private foundations and from government sources to support all different aspects of the organization's work. So sexual and reproductive health care, sex education, HIV prevention programs, sexual assault survivor services, and policy advocacy efforts. And then second bucket is if/when, hopefully we get funding, we have to submit a lot of reporting about what we did with that funding. So it's those two things, asking for the money and then reporting on it is basically how I describe it.
Hey everyone, my name is Ingrid Williams. I graduated from the community health program in 2024. My employer is One Medical Group. It's a primary care group that services all of New York City, and we have offices throughout the country as well. Specifically, I'm part of the clinical team as a phlebotomist, and I am also part of the clinical effectiveness team. We help create new programs and service offerings for our patients, and I'm currently working on our menopause pilot to offer different menopause services for our patients. Thank you.
Hey everyone, how are you? My name is Monique Jaques. I also got an MPH along with everyone else on this panel tonight. I graduated in 2022. So just a couple of years ago. My current role is I'm the director of doula programs at an organization called Mama Glow, and I do a great many things at my job, but I think the most relevant to this kind of this discussion is that I run a lot of our programs, one of which is known as the Citywide Doula Initiative, and we are one of 8 subcontractors of the New York City Department of Health, and we provide doula services to low-resource folks around New York City.
Thank you. Now that we know a bit more about our panelists, we'll proceed with the moderated questions. So our first question is for all panelists. Why did you choose to pursue a graduate degree in community health? What about Annette?
I can go first.
Oh, okay. Perfect.
Okay. Yeah, we can start. Okay. Go ahead. Thanks for the question. So I I went back to school in the kind of the middle of my career. I had been out of college for 10 years and I was like, oh yeah, you know what I want? More homework. But no, but my first exposure to public health was working on this project called Syringe Litter Abatement Initiative when I was working at New York City Parks Department. And we install syringe litter kiosks in parks in the South Bronx and Washington Heights, where they're most affected by the opiate epidemic, and track the number of syringes in the parks, in the kiosks, and on the ground. And it was really great to work with local harm reduction organizations and Department of Health and Mental Hygiene on this project. And so that's where it started. And then I really got propelled into public health when COVID happened, and I discovered my interest in language access and health equity in immigrant communities. I was deployed to work full time at one of the city-run massive vaccination sites back in January 2021, and I chose to work at the Lower East Side location because I'm bilingual in Mandarin, and it was a very intense experience, and I was able to witness and be a part of the city government's response to the pandemic. And I see kind of the good things and the bad things. And from that experience, I decided that, okay, I need to go into public health more seriously. And I want to be better equipped to serve my community and my city and understand all the social determinants of health and the history of health disparities and inequities in New York City. So CUNY's focus is specifically very much on social justice, and the fact that I think a third of the alums go into civil service really drew me in. So that's how I ended up doing more Blackboard discussions. To you.
Thanks, Annette. That's really cool to hear your story. And like you, I also had about a 10-year gap in between my undergraduate and grad degree. And I had a pretty non-traditional pathway to this program and to public health in general. So my undergraduate degree is in writing, literature, and publishing. And for the first 6 or so years of my career, I was a journalist, first working in print media and then in digital media. But I got to a place of real burnout in that line of work, and I was just looking for something else that I could do where I could use writing skills. And so this is not a career tip, but I went to Indeed.com and I typed in writer and tried to see like what would pop up. And I saw a grant writing job at Planned Parenthood of Greater New York, where I now work, and I ended up getting that position. And that was really my first ever exposure to public health and working at a public health, centered organization. I didn't know that the MPH degree existed until I saw that a lot of my coworkers at Planned Parenthood had that degree. And I really thought they were doing cool things with it, like designing and evaluating and implementing sex education curricula. I thought that was really cool, and that was a big factor in my decision. I just wanted to be more like my colleagues that I really admired, the work they were doing. And the longer I worked at Planned Parenthood, the more I learned about sexual and reproductive health from the public health perspective, just being in meetings, learning from my colleagues who are subject matter experts. And it really sparked my interest. And so I decided to follow that genuine curiosity and interest I was feeling and decided to apply for the program.
So just like everyone else that's spoken, I also had a very long gap between undergrad and when I started my MPH. I wanted to go into public health because my mom is a nurse. So I've been in exposed to the healthcare field for most of my life. And I specifically wanted to get an MPH because at my job, when I was to work part of the clinical effectiveness team for our program development of the menopause program, I wanted to make sure that I had the credentials to really give proper input into the program formation and evaluation and be able to really contribute with all that the program had to offer. And this degree was versatile enough to allow me to pivot if I really needed to within the field. And it also provided me with all of the skills that I needed to kind of move our initiative forward. This program gave me a lot of practical applications that I was able to use in my job and allowed me to pursue other research interests as well that I do on the side. And it really set me up for success when I applied to PhD programs.
I'll go. I'm also kind of a pandemic SPH baby. There used to be this funny term, I can't remember what they called it. I'm trying to think of it. But all the people that went to public health school after the pandemic, I can't remember. It was like some term. Anyway, so it was me. Hi. So I also had a long career in journalism. I was a photographer internationally for about 10 years. And then, I didn't know what public health was for a really long time. And because it just wasn't talked about, it wasn't marketed, before the pandemic. It was like a whole nother kind of thing. But someone I was interviewing was telling me about it. And I was actually talking about how I was thinking about going into nursing. And she looked at me and she's like, no, you want to go into public health. And I was like, well, what is that? And after she explained it to me, I was like, oh, yes, of course. That really fits everything I'm doing, everything I have been doing. It was a really nice transition. So it was kind of something I kept on the shelf for a long time. And then pandemic happened. I was like, well, it seems like I have a lot of time. I'm going to use this and I don't know how to make bread. So I went to school and that was kind of it, more or less. But it was an interesting journey for sure to go back to school.
Now we're going to do like the individual questions. So, Ingrid, what factors were most important to you when choosing a PhD program? She's in the PhD program. What tips do you have for someone considering a PhD or beginning the application process for a PhD?
Okay, so the things that I wanted to really focus on when I applied to the PhD program were the courses and competencies of the program, their class size, um, and the type of faculty and that were at the program and what the research was. So, in terms of the courses and competencies, I would recommend that you take a look at the program's course schedule and see if there's any courses of interest that align with what you want to pursue. You can review the program competencies and ensure that they're going to prepare you for your future career goals and they'll be applicable in your field somehow. Um, you need to make sure that the skills that you're developing in your program are going to be attractive to future employers. So you want to be exposed to a little bit of everything. Um, you don't need to be the jack of all trades, but exposure to more things through internships, research positions, and future collaborations with colleagues will make you a more attractive applicant to future employers. And that's a really important thing because the job market is very hard right now. And you want to make sure that your application stands out and resume stands out apart from everyone else. In terms of class size, I was looking for a program that had smaller class sizes because remembered in my undergrad, our class sizes were pretty large and it was hard to really make that personal connection with your professor and with your peers since there were so many students. So I would recommend smaller class sizes because it's able to facilitate discussion, which you'll be doing a lot of in your classes during a PhD program. You'll be learning about theories and different methodologies, and you're going to be involved in a lot of thought-provoking questions. I feel like you're going to be able to respectfully challenge each other's ideas and push the conversation forward and outside of the box, and you really can't do that with a larger class. Um, in terms of the faculty, I would say that when you're looking at different programs, research the faculty members within the department that you're interested in. See if their interests align with yours. And if there's anything that catches your interest, such as like their research styles or their topics that they're researching, you can send them a quick email and let them know that you're interested in their program at their institution, and you would want to connect with them to get a little bit of more information. And those small little interactions kind of help during the application process because they may be part of the application committee and remember that interaction that they had with you on a quick Zoom call that you maybe had with them. Um, Another recommendation that I would have during the application process is to have a core committee of people in your life that can review your personal statement. So I had a group of 3 to 5 people who were able to give me, they were strong writers, strong communicators, and knew me personally that were able to give me constructive feedback on my personal statement. And I think that's where you really have to shine in your PhD application. Um, the application is looked at holistically, but there's certain things that they really look for. And I was really able to tell my story through my personal statement. And I found also that co-writing with other applicants can help a lot because you'll be able to get feedback from them, bounce off ideas, and just get in the framework of doing that type of writing and reflection that you'll need to do your personal statement. And the last thing I'll say is that you need to make sure to clean up your CV and update it with all of the um, presentations that you've done, any publications, any panels that you've done, like the ones that we're doing tonight, if you're a panelist, um, any honors or awards that you've received, any professional memberships. Don't leave anything out. You want to make sure you highlight your entire professional and academic career on your CV. So the admissions committee can really see who you are as an overall applicant.
Thank you for sharing. So now for Caroline, how have your skills as a magazine writer and digital journalist carried over into your work in public health? And how has your public health education changed the way that you approach writing or how you think about the role in literature in addressing public health topics?
Yeah, I love this question. And I use my journalism and writing skills every day in my current job. I think I said in the chat that the journalism to public health pipeline is very real, and I've met a lot of people who have followed that because I think there's a lot that's transferable. So part of it is really obvious, like you need to be a strong writer to craft a good grant proposal, and I have a lot of experience writing, so being, having strong writing skills is an obvious match. But there's a few other things that come to mind too. Mainly around communication. So in my later years as a journalist, I wrote a lot of articles about public health topics and just health topics in general. And I really tried to hone the craft of communicating complex scientific information in a really understandable and accessible way for just the average layperson in the audience. And that's still super important to my work now because the institution or the person that I'm asking for money might not have a lot of knowledge or expertise about public health. And it's still really important to clearly communicate what public health issues, Planned Parenthood is trying to address, why it's important that we address them, and how we are actually making a difference. And especially lately, I'm sure many of you are aware that the policy landscape around sexual and reproductive health is changing really rapidly, like day to day, week to week. There's so many changes, and it's very confusing and very complicated. And so I use those like public health, clear, accessible communication skills every single day in trying to communicate with funders about the impacts of all these policy changes. I also took a class at CUNY SPH about health literacy, and I think that helped me for really even further hone my plain language communication skills, and I really recommend that class to current or prospective students. I found it really, really valuable. Also, within an institution, fundraising work is a lot like reporting a story. I have to have relationships with folks in every different department across the organization, and I'm constantly calling them and asking them for information that I need to write grant proposals or to write grant reports. And it really reminds me of the relationships that I had with sources when I was a journalist, and I'm on the phone all the time, which is also what it was like when I was a journalist. And I would say my public health education definitely changed the way I approach writing and grant writing. Thanks to my education, I am so much more confident in finding and analyzing public health data that I can put into grant proposals to strengthen them. I'm a much stronger communicator. And the community health concentration specifically was really valuable because I fundraise a lot for community health programs like sex education. And it's now like I speak the language of the staff who actually implement those programs. And I can be a much better thought partner because I can, all my classes in the community health concentration really taught me the ins and outs of how you design, how you carry out, how you evaluate those programs. So I can offer better suggestions and I can ask better questions when my colleagues and I are working together to develop a grant proposal for a program. So that's the other thing that comes to mind is that I feel like I speak their language a little better, and that really improves our collaboration on grant proposals. And lastly, I'll just say in terms about the role of literature in public health and writing in public health, I think I always held this belief even before I went to SPH, but I think my education really reinforced the idea that personal narratives and stories are really important to public health communications, because storytelling is a really powerful way to personalize public health topics that can feel very big and abstract, and helps to make the impacts of public health interventions or public health problems really, really tangible. So that's how I would answer that.
Thank you. So now, from Monique, how did your time working in global and community health abroad shape your approach to maternal and reproductive health in the US context?
Sure. I think, so one of the things I guess I would point out is that, these things are in silos, there's no such thing as like, well, there's global health and there's America, the US health system. Like these things are very interchangeable and they're all very related. But I think one of the key kind of things to think about is that, every health system exists within a context. So it's not just, there is a system and it exists, there's a community that shapes it. There's, various different, kind of stakeholders that are involved. And I think, kind of going through the SPH process really made me kind of understand like in a deeper way, like all those stakeholders, and how they're all kind of interconnected, which is something I think we all know, but I think, in terms of like really kind of understanding and studying like the way that, advocacy impacts program development, which impacts, success and outcomes, is really kind of like a through line. And those all have different kind of factors.
Oh, and for additional context, Monique completed the maternal, child, and reproductive health specialization at CUNY SPH, and this specialization is no longer offered, but CUNY SPH is offering a new MPH concentration in sexual and reproductive justice and health in this upcoming spring term, and you can read more at the link that Chelese will now put in the chat. So, now for Annette. What has stood out to you most about working in the public health system in New York City, either in a good way and or a challenging way? And how has this experience shaped the way that you approach your work?
Thank you. I think what stands out to me the most is how many people have dedicated most, if not entirety of their careers to the city. I have met some of the smartest, most committed, most interesting people, mishmash from all kinds of places, people from here and everywhere. During my time working for the Parks Department and now for Department of Homeless Services, and these folks have been through it all. Back when I was at Parks, I'm hearing stories on how Hurricane Sandy like tore everything up and they had to do all this response and how to like fixing the parks up. Or you know, different there with each mayoral administration comes with different commissioners and different priorities. And I'm just very fortunate to work with people who have such a great wealth and breadth of knowledge, that are so experienced. However, that being said, they're also very committed to doing things the way that they've always done them, right? It's I work with a lot of folks, and they're all kinds of ages, but inevitably, there's a lot of folks that's been here for a long time and want to keep doing things the same way the long time because we've done it this way and we'll continue doing this way. And it's like, well, but it doesn't have to be that way. But they're also just people like me and my colleagues who are relatively younger and have different ideas on how to improve things and bring in new like technologies and different ideas on how we can do things maybe more efficiently or better or whichever. But the reason why, so I actually I was at Parks and then I stopped and went to school full time and then I got a job at DHS. And the reason why I came back and continue to stay in city government is because I truly believe in living in the city and serving the city and the community that I work in, that I live in and work in. And I believe that I can affect more change from the inside. Especially New York City is the richest, most well-resourced city in the United States and probably one of the most in the world. And we have the resources to do so much. And there's definitely opportunities to do pilot programs that smaller municipalities may not have the resources or bandwidth to do, but we can try it out here and that maybe other cities can follow suit and replicate the success. So earlier I spoke about being on the parks and doing the syringe litter kiosk program. And so I haven't been around all that long in the city. I haven't spent, 30, 40 years in the city, but I've been around long enough to see the first overdose prevention center open in the United States, on Point NYC. And I like to think that our work and our data and all this stuff helped play a small role in that. But yeah, like I said, in New York City, we're voting for a new mayor in less than 2 weeks. Early voting starts this weekend, and with each new administration, the priorities and the personnel change. I think that people have maybe certain ideas about government. Yes, all the caveats are true, right? It's the pay is less competitive. What is a raise? Who is a bonus? I don't know. Who is she? There are a lot of these restraints, but the city really does need young, smart people to join so that, we can make the place where we live a better place for everyone. But anyway, I'll stop here. Thanks.
Thank you for sharing. So now this question is for everyone, for all panelists. What job search tips do you have for those currently seeking employment in public health? Whoever would like.
I can go first. So, I mean, I will start by saying I'm hearing from friends across industries that the job market is really terrible right now. So I don't know that I have anything super valuable to share, but one thing that I've been told many times, you've probably all heard, but I think is still very true, is how important it is to tailor a resume and cover letter for each position. And one way that I make that easier for myself is I have like a very long sort of like master version of my resume that has like every job I've ever had, every volunteer thing I've ever done, every accomplishment that I think might be possibly worth highlighting for different types of jobs. And then I just pull from that larger, longer document to make like a shorter resume that's more tailored for each application. So that's been helpful for me in my own job searching over the years. And then I also want to plug that I really like a blog called Ask a Manager. It's askmanager.org. It has so much good advice about job searching and like navigating conflicts at work. And I've been reading it my entire adult life, even just for fun to read about other people's work drama. So because people write in letters and the author of the blog responds and offers suggestions. So that's just a resource that I have found helpful and thought I would pass it on in case folks hadn't heard of it.
I think also LinkedIn is pretty helpful in the job application process. It You can tailor it to like your search keywords in terms of things that you're interested in or companies that you would like to possibly work at. Um, Indeed, I've also used a lot. And one thing I would say is that don't be afraid to apply to a position because you don't think you're qualified. Um, the position is giving you the bare minimum, like the job requirements, but there may be things about your application that could make you stand out as an applicant that you may not be thinking of. So you don't want to sell yourself short, just because you don't think you're the ideal candidate. I think you should always try and put the best foot forward that you can, into any application because you may be the person that they're looking for.
I can go next. So okay, I'll give some city specific tips. And I'm happy to speak more offline about navigating the system. The city is hiring all the time. The city is hiring a lot. There is a huge person like a head count. There's a huge amount of attrition. A lot of people just like left during the pandemic, went to all kinds of different places. Either they retired early or they went to the private sector. But the city is hiring all the time, a lot for all kinds of things. And you should really go on. Okay, if you work in New York, if you live in New York City or want to move to New York City after your degree, the one, Elena, perhaps you can go look on city jobs .nyc.gov. And if you have a master's in public health, you should be looking for positions under the civil service title of city research scientist, and that's a title specific to Department of Health and Mental Hygiene, DOHMH. For another tip is sign up for a civil service test. So I'm currently not in the city research scientist title. I'm currently in this other title that's kind of unrelated to my degree. And it's only because I took a test back in 2019. And then when I finished my degree in 2024, I was like, hey, I'm available to work. And they're like, okay, we'll call you in. And I was like, okay. So yes, take civil service tests. There are titles that are education and experience requirement. So based on like how long you've worked and also what kind of degree you have, there's also titles that are based on more like the tests that I was talking about. But yeah. But also just reach out to your network. Talk to people. Talk like the panelists here or just people around you that that you think are doing cool stuff or adjacent to cool. I don't know if I'm doing cool, and then maybe they can help you. They know somebody and they can help you to brainstorm and connect you to different people.
Yeah, so this isn't particularly SPH focused, but someone once told me a very long time ago, which ended up being true, was that everyone you know in school, you're going to run into again. It could be, somewhere down the line, it could be, very soon, so it's important to kind of keep those connections and keep the network that you're kind of building. Because you don't know, like someone could end up being a colleague, they could end up being like a similar, stakeholder. It is a wildly small community, which really kind of benefits us in some ways, because we kind of get to draw back to those kind of connections. So I would just, keep that in mind. And of course, like all the other wonderful advice everyone else said, but yeah.
Thank you all for sharing. So now we have some additional questions. How has your career evolved since finishing your graduate degree? And this could be for any of you.
I'll take this one. So since I've graduated, I've joined an amazing research team led by Dr. Spring Cooper. She's the department chair of the Community Health and Health Policy program. And she co-PIs with Dr. Andrew Porter from the University of Miami, and we've been doing a research project on HPV vaccine hesitancy. And we recently just got 2 papers that were published in the last couple of months, and we've been doing a lot of work on it. And I've collaborated with other students who I graduated with in the last year or so, and I've just been working on applications. I got into the PhD program. The program that I'm doing now is a lot of work, but it's very rewarding. And I'm also doing a TA position with Pub H 611, the Health Equity Advocacy and Communication class with Dr. Phil Kerensky. So I've been very busy since I've graduated, but the work has been very rewarding.
Okay. What student opportunities or resources did you take advantage of at CUNY SPH? So that could be like student groups, volunteering, student employment, or faculty research.
I can start with this one. So I I was actually a little surprised when my advisor Emma uh nominated me to be a part of the panel because I hated school. School really sucked and it was really hard for me to be in school. So a big resource I took advantage of is the Office of Accessibility Services. I suffer like many people, I suffer from depression, and sometimes I just do not have the wherewithal to turn in Blackboard posts on time. Um, I'm hopefully a common experience. And my professor just like, yeah, talk to them, figure something out, and it was good. I just didn't know that that was an option that you can have some help and some room and grace. So definitely explore. If you're struggling with, especially if you're working and you have a lot of things going on, if you're struggling with different things, like go talk to them. They're super helpful and I really appreciate them.
Yeah, that's really similar to what I was going to say, which is that I wish that I had taken advantage of more resources during my time in school. So I'd like that's like a lesson, I guess. But part of the reason why I don't think I took as much advantage as I could or should have was because I was working full time and in school part time, and I struggled with the work-life balance aspect and work school life balance. So the one resource that I did use that was very helpful to me was the counseling services. There are free counseling services available to students. And so I worked for a couple of months with a counselor who helped me with like managing anxiety and feeling overwhelmed about school, and also introduced me to some really helpful like time management and scheduling practices that helped me feel like I was a little bit more in control of my time and made my life feel a little bit less chaotic. So that was very helpful to me.
I can also vouch for the Office of Accessibility Services. I think there are just so many resources to take advantage of at CUNY SPH. So the next question, what advice do you have for those with little to no professional experience as they begin their public health degree or are considering going back to school?
I can take this one. Well, I guess you could say I had professional experience. I did not have public health experience. And it was really interesting because I felt like a lot of people in my classes were on their way. They had like entry level jobs in the kind of health fields. And I was like this little black sheep, who was a journalist and like, lived abroad and did something, very different. And that's okay. Everyone comes to school for different reasons. But what I would say is that you have to remember that you have like transmittable skills, the things that you have from whatever background you came from are applicable in public health. This is a job that's very communications driven. It's very partnership driven. Like you're working with people all the time. So those managerial skills, if you worked whatever you did, in high school, your job, you were a manager, you talked to people, you kind of figured out schedules. All that is so important in public health roles. It's important in school as well, but like once you do finish and become a public health professional, those skills are just so important. And having a leg up on that is just really wonderful.
Thank you. So did you know that what you wanted what to do with your degree once you graduated or even before? Did you have any idea? Or any-
I mean, I can say right off the bat, no, and I graduated earlier this year and I'm still trying to figure that out. it feels like a little bit like a double-edged sword to me. And Office of Career Services put on a great event while I was still a student that was like about non-traditional pathways to public health. And wow, like the panelists had such a wide range of different jobs, and there are so many different directions that you can go, which is exciting, but also it feels like, okay, so what are my next steps? And I haven't figured it out yet. But I think ultimately it's a good thing that it's so broadly applicable.
Actually, I was just gonna type it in the chat, but can I just I'll just say this part, well, maybe.
Yeah, of
But
course.
yeah, just another little tip about people that are beginning their careers, just period, in anything. So again, more about city jobs. I started with the city without a master's degree, just a bachelor's in human services, whatever, random. But for those of you who don't have the master's yet, you can get a job in the civil service title of community coordinator, which is a title that doesn't require tests or degrees. And if you work for the city full time, you may be eligible to apply for, there's a program called Mayor's Graduate School, Graduate Scholarship Program, where full-time employees get a scholarship to go get a graduate degree. Not that I think everybody here may be a student, so may not be applicable, but just say, yeah, community coordinator is a catch-all role title for many entry-level roles in the city.
Thank you. So, what is the most rewarding part of your job for anyone?
I'll go. I feel like this might come out as a little cheesy. For me, I think it's like the opportunity to serve. There are so many different people in New York City, in the US, with so many different needs. And, when you're able to connect someone who has a need with a service, it's very satisfying. Just knowing that, you've made their day a little bit easier, you've made their journey easier, you've made their in my particular experience, birth experience easier. And, that's something that can be really powerful to someone. And I'm sure everyone in this panel will say very similar things too. I think we all are drawn to this part of, health for a reason.
Yeah, I think something I find rewarding is I feel like a lot of public health work is like doing harm reduction for like the systems that we all exist in. Uh, for those who don't know, Planned Parenthoods provide care to all people, regardless of like their ability to pay, whether you have insurance, what your immigration status is. And it is just, for me, it's rewarding to raise money for that effort and to know that we are like patching a hole where people are like uninsured or underinsured, or because of like very restrictive and punitive immigration policy, they can't access insurance, or for like any reasons that people otherwise might not get health care, that we're sort of helping to patch up a harmful system. I find that rewarding.
Thank you for sharing. So, this is our last moderated question. How do you continue to grow as a professional within your current role?
I'll take this one. Um, in my professional role, as I hold two hats. I'm a phlebotomist full time, and I also do part time work building out our menopause program at the company. Um, the phlebotomist work, it's pretty standard. You don't really grow from there unless you want to become a lab manager. But within the development of the menopause service offering we have at the company, I am looking for ways to network with other clinicians and other educators to kind of make our program a little bit better. Networking is really important because you can learn a little bit from everyone. And through networking, I've been able to be on different research projects with colleagues of mine from CUNY SPH and other institutions as well. And I always look for ways to push myself out of the box, like professionally. I want to be able to grow. I don't want to stay stagnant. So I look for ways to kind of build my resume in terms of different internships that I can do part-time. Since I work full-time and I go to school full-time, the internships are a little bit difficult. But if you do work part-time, consider doing an internship here or there to kind of build your experience and build your resume. Um, I would also say to make sure you keep in contact. A lot of another panelist mentioned this, but keep in contact with the people that you graduated with because you never know that they can be a connection for you down the line if you do want to change positions within public health and you're looking for like another company to work for. You may remember you had a classmate from long ago that she or he has moved on and worked at this other company that you're interested in. Reach out to them on LinkedIn or so and see if you can connect with them and they may be able to help you apply to that position.
Thank you so much. So now let's hear from you all, the audience. Chelese will read your questions from the chat, or you can also do the raise hand feature if you want to ask it out loud.
So 2 of the questions were already answered by the panelists, so thank you. This one wasn't answered just yet, so I will read this one out loud. This is from Dominique. They says that currently I work in foster care, which in a way works in various sectors of public health, as we're involved with the court systems, health, and education. I have an interest in pivoting to a public health role. How can I make this transition successful as I do have my MPH? Also, how helpful do you all believe is getting a CHES certification, which is the Certified Health Education Specialist certification?
I think I can start us off. Hi, Dominique. I would say think about what level you want to work at, like micro, macro, meso. I've kind of determined early on that working with people is not for me. People are difficult. With the exception of you guys. No, probably not. I know you guys for 5 minutes. No, I just direct client work is not for me. But that being said, I do really enjoy sitting in a level where I am in contact with people who are doing operations and field work, but also connecting them with like the executives and also just like commissioners that or whoever that are making decisions. So then it's kind of like a conduit where in various roles that I've been in this kind of position where I translate what's happening on the field, in the ground, in the operations, and into like larger policy and whatnot. So to you, I would say like if you currently work in foster care and you're like, yes, I want to keep working with people directly, then there's certainly a lot of community-based organizations that are doing that. And also I mean also within city government, there's also just levels of stuff too. But yeah, I would also just look into if you say like, hey, maybe now that I have this like super knowledge of like how everything meshes together, then I would encourage you to really look and again look into the city. Just gonna be beating this drum the whole time because we need new people and we need young people. But yeah, there's definitely a lot of roles where you do a lot of interagency or coordination. So working with ACS, working with like DOHMH on initiatives to improve outcomes for different populations. But yeah, good luck.
Dominique, I see that you raised your hand. Did you have a follow-up question?
Yes, I thank you so much for sharing that and excuse the noise. I'm commuting from my job currently, so I apologize I'm not on camera. But I do have an interest in researching ACEs and the impact on long-term health, especially in communities of Black and Brown communities. So I'm with you with the people are difficult, and they are, especially when you have to provide them a service. So how can I get back in that research field in that way?
Yeah, I don't work in research, but I have already changed my career one time. And I think, and I have applied for jobs since I have graduated. I think it's okay to be like, frank about that in your applications and your cover letter and explain that you are trying to make a change and explain why you are trying to make a change and like bring whoever is reading the letter through on a journey of like, I started my career doing this. These specific things about my career really sparked my interest in doing research on ACEs, and like make it into a narrative. That's my writerly advice. But I think it's okay to be like very open and honest in your applications that you are looking for a change and to say why. Though I'm not sure if you've heard that before, but that helped me when I was making a career change.
Just to follow
Thank
up
you
on
so
Carolyn's
much.
response, sorry, Dominique. I think you can also, along with creating a narrative for yourself, reach out and look at different institutions and see what kind of research they're doing. And if it does align with what you want to pursue, you can reach out to the faculty and the co-PIs and see like if you can join their team, kind of reach out to them via email, and just make an introduction, tell them what you're interested in, tell them your experience, and see how you would be able to fit into their team.
Thank you so much. I really appreciate it.
Another question from the chat from Maxine says, how much would you say that your previous education and work experience helped you to find a job in public health, not having much public health experience formally? And Caroline responded and said that she thinks that almost any job or education experience can have transferable skills to public health, highlighting some of the skills that Monique, one of the other panelists, was talking about: communications, project management, collaboration, and people management. And then we had another question, and that says that what suggestions do you have to stand out within your application for a job? And it was answered: attending free online webinars as ongoing professional development, which are free and open to the public. Caroline gave an example: the New York City DOHMH Sexual Health Advisory Group webinars, and I will find that link and I will drop it in the chat for everyone to have access to that. And Jasmilka said, open to any of the panelists, where do you see the future of public health going? Are you concerned for your position's longevity due to the political climate and government budget cuts to certain public health programs?
I'll take that. I think there's a lot of uncertainty in the world, and that is something that we deal with every day. Um, I've kind of seen this from both sides. We're very lucky that we live in a progressive city like New York City, where my program is currently being there's a term for it. I'm not entirely sure what it's called. They're trying to make it into law. So before it was preferential funding, but from a mayor. So it was a Mayor Adams initiative. We assume it will continue, but we are trying to make it into law. That being said, we have programs on the federal level that are being cut. Every day is a very interesting journey here in the public health world. And, there's always ways to kind of move funds around and pivot and, but I wouldn't let that deter you from exploring public health and being a part of public health, just because things will change, things will morph, things may not stay the same, but there's always kind of different outlets for funding, and there's ways to, we are scrappy, and we have to be. Sorry, Caroline, go ahead.
Sorry, I'm so bad at Zoom. I was going to say I'm super worried about the future and about funding cuts. But if anybody is interested in fundraising work, private fundraising, unfortunately, is going to be really important for the next couple of years with government funding becoming less reliable, especially from the federal government. And it is a way I've seen a lot of fundraising jobs as I've been out browsing. So if anybody wants to talk about that offline, I think you're going to get all of our contact info. But it is a way that you can help organizations or movements that you care about by trying to help them track down funding. And I think that's going to be really important over the next couple of years.
I also just want to add that there are also things that's not directly like a public health program. So for example, I wouldn't say my role has that much of a direct connection to public health, quote unquote, in the sense that I don't work for the Department of Health and Human Services. but like everything is public health. Like I think just having the background and understanding of these very basic things, like why are people sick? Why are the policies like this? I think having that background with you will really benefit you in a lot of different areas. And like right now, one of the procedures that I'm rewriting with the health services office that we have is the overdose prevention and substance use policy in the shelters. We just kind of stumbled into that one. I was really lucky. It's like, yes, this is the one that I do actually care about and really like. That is right up my alley. So yeah, I would say it's public health is everything is public health. All politics is public health. And it's important to, I think, carry that with you and broaden your search as you look at different options.
I have a question for Ingrid. What made you decide to get the PhD versus the doctorate of public health?
Well, there's a difference between the DRPH and the PhD. The DRPH is more, what would you say? It's more if you want to do project management type of public health, like if you want to be a program director of a large agency, or it's more like it's an administrative type of degree. Like if you want to go into management within a public health department or company. The PhD is more academic and research based, and that's what I wanted to do. I wasn't really interested in like managing a public health company or agency. So I looked at their course offerings and stuff, and they were similar to the PhD, but the outcome wasn't what I was aligned with. So that's why I went with the PhD. Since I'm doing research now, and I want to go into teaching as well. That was more aligned with my interests.
Thank you.
I have a question. Can I ask?
Oh, yes, please.
For Annette, you said that you don't work in the public health department. So where do you work? Not the company, but in which area, you know?
Yeah. I work for the New York City Department of Homeless Services.
Thank you.
Yeah, and just to piggyback off of that, I look at the city job board a lot, just mostly out of curiosity to see what's going on. And I feel like even outside the Department of Health, there are so many jobs in other areas of city government that are really related to public health, like what Annette is doing. Like the Department of Environmental Protection, like HPD, Housing and Preservation and Development. I feel like there's a lot of options there.
Yeah, I think Chelese, is there no more comment questions?
Not seeing any other questions in the
Okay.
chat.
Okay. We have some additional moderated questions. So the first one is, can you tell us about your field work and capstone projects and how it connects to your current work or future goals? And for those not familiar with the program, it's like the last 2 semesters of your MPH, you have a capstone in field work that continues like 180 hours over those 2 semesters.
Yeah. This is my favorite question because I got my job because of my capstone project directly. So my capstone project was with a group of folks, and we were working on a program called By My Side, which was a fledgling doula pilot program in New York City. The By My Side program eventually turned into the CDI program, which is now where I work. So pick your capstone carefully. I almost didn't get in, and I was very upset, and I like talked to some people, and I am getting in because I knew that I wanted to do maternal health. So, fight for what you want.
Question on that. So you were part of the pilot project. Somebody else created it or you created it?
No, as a student, I did not create it. But we were working on a part of an evaluation project through one of the CBOs, the community-based organizations. But having experience with this program is something that my current employer was like, oh, you've done this before. Like, you know this program really well. And I did. And that was basically why I was hired.
Okay.
And,
And for
and
the
other things
field
like,
work and the capstone, so for the field work and the capstone, you look for things that you were interested in to do the field work there. Or whatever, whoever accepted you, or for anybody is these questions, or whoever accepted you first, that's where you went for. Do you understand my question?
yes,
Yeah.
Yeah, so
take this. Yeah.
I think maybe it's changed over the years, but I think I'm the person who graduated most recently for the community health concentration. There was like a menu of fieldwork projects presented, and you could apply and like list your preference. So there, like the work, what you didn't have to go out and find it on your own, which may not have been. Maybe it's changed since, earlier years, but there were like six different options we could choose from and rank in order of preference. And I personally got my second choice out of, so I think most people were able to get like their first or their second. Um, but they were really diverse, like across a broad range of different like public health disciplines.
Thank
I'll
you.
say, my capstone and field work is a little non-traditional as well. I don't know if this is, I don't know if this is an option, but I just want to like commend CUNY's flexibility and shout out to my advisor, Emma, who is the best. But yeah, I was working, so like I said, I was working for Parks, and my capstone, I wrote it on the pilot program for the syringe kiosk thing. And I had a dream to publish, but publishing it, publishing hard, writing hard, um, writing a research paper hard. But basically I wrote up the experience on that and then also analyzed the data that's available on open data, that our team helped put on open data, as part of that. And then for my field work, I got an internship at Department of Health, which is HRTP, and I was able to satisfy that requirement. So I would definitely ask your advisor.
Okay, are you currently working on any special projects or initiatives that you might like to share with us? I think some of you have spoken about this a little, but if there's anything else you'd like to add.
I unfortunately am not. The name of the game right now at Planned Parenthood is sustaining what we're doing currently, and surviving. So unfortunately, I don't have anything super exciting going on.
I'll jump in. I have been working with Dr. Cooper on HPV vaccine hesitancy, and we're trying to come up with a toolkit for parents and caregivers to kind of educate them on it's a decision aid. Sorry, decision aid on how to help them make the decision if they want to vaccinate their children or not. But we want to inform and educate them and also give them confidence that they're making the right decision for their child. So we are the project that we're going to be doing, and that we're applying for a grant for, is going to be the first stage of developing this decision aid, and then the second half of the project will be to implement it, and we will do the evaluation for it to see if it actually worked. Xavier had a question. Can you describe what you do as a program manager? Okay. So as a program manager for the menopause program that I'm doing with One Medical, I kind of was part of the brain work and what we wanted to envision for the women's health department. So we did a lot of research, a lot of patient education, patient interviewing to see what was important for them. And I created a timeline for how we wanted to get things done. And estimated how long it was going to take us to do it because we had a certain amount of money and we had a deadline from our company for when they wanted things to be done. So I kind of helped organize and facilitate a lot of the moving pieces to get to where we are now. So there's also a program manager certification that you can get. I'm still working on mine, but it really helps you stand out apart from other applicants who are also applying for program manager roles. So I think that's really worth considering if you want to go that route.
I think we have time for one more question. What's one lesson you've learned in your career that you wished every public health student could hear?
This is a hard question, but I will kick it off. I think Monique spoke to this earlier, but my experience is that so much of public health work is relational, partnership building, collaboration, and those skills are really important. I think even if your job is not like interfacing with clients or like working with a lot of people, it still helps to know how to work with people effectively, how to be a good communicator, how to be a good collaborator. That's something that I've had to get better at in my career, and I think it's really important for almost any public health job.
I think it's also really important to venture out into areas and develop skills that you are not comfortable with. Not comfortable with, but that you're not exposed to or you haven't been doing before, because it will really force you to grow and to kind of develop and hone those skills. And they're transferable. So you can use them within different areas in public health. You may not think it's relevant, but it could be, and it could help set you apart from other applicants.
I would say one thing for me, and I think just maybe general career tip is uh sometimes you're the subject matter expert. If you've been working on something for a long time and you're presenting in front of a bunch of bosses, they're hearing from you. You're the expert. And yeah, there's a couple times where I had to present in front of the boss's boss, and it's nerve-wracking, but then you're like, wait a minute, no, they don't know the stuff. I know the stuff. So I think especially for those who may be earlier in your career, I think like, yeah, of course, like, don't get too arrogant. Don't, it's like, oh, I have a master's degree now, I know everything. You really don't. I've definitely heard that from like somebody who's graduating, and I was just like, oh, I feel very prepared to go into a career. I was like, what? But just like, but yes, of course, the humility and humbleness, but also just be confident in yourself. I think that you have something meaningful to say, and that your position and opinion is good, maybe. Sometimes.
Thank you so much for sharing. I know that one was a thinker. So we're coming to the end of our program, and I want to thank the panelists for being here with us tonight. And to close out, each panelist will give us their final thoughts. So first, Ingrid.
Okay. So I just want to thank you guys for the opportunity for having me here tonight. I really encourage everyone who is looking to apply to CUNY SPH, or if you're already in the master's program, to really immerse yourself in the classes, get as much as you can out of them, because it would prepare you for what's to come. You may not think it's relevant or applicable now, but it will be in the future. And you may be consumed in the coursework, but remember to look out and kind of set your goals for yourself and use that to motivate you throughout your program. Because it may seem daunting, but it really feels good on the other side once you get there. So don't give up.
Okay, Thank you. Next, Caroline.
Yeah, I think I just want to encourage anyone who's nervous about going back to school that you'll be okay, especially if you're doing it later in life. Like I think a lot of us we had talked about how we did a lot of stuff in between undergrad and grad school, and yes, it was hard to go back, and yes, it was hard to balance work and school, but it was also really wonderful to learn new things, and I feel like it really opened up both my brain and my world in new ways. So yeah, I would just specifically encourage people who've been out of school for a while that like you can do it. That's most the message I wanted to give. Um, and if anybody wants to talk about working in fundraising, going back to school, at a sexual and reproductive health organization, let me know. It's a hard field to work in right now, and so I think it's important to build a sense of community. And I'm always happy to chat about what's going on. So feel free to reach out anytime.
Thank you. Now, Annette.
I know it's grim out there, and every day we're bombarded by all this horrible news happening at home and abroad. And it's easy to fall into a pit of apathy and despair and cynicism. But very cliche, I try to focus on what I have control over, doing well at work. Uh, okay, work aside, because we're very work focused today, but making time for friends and family, and also just being kind to yourself. It's if you can't take care of yourself, then you can't do other things. So it's important to have you come first, because who else is going to take care of you if you don't do it yourself? So great job, everybody.
Yeah, and I'll just echo kind of what Annette says and add that, it is we're here, it is a passion driven, field. And we're all here because, we want to do so much. We want, to kind of enact this really amazing change. But it happens really small and slowly, and it's very small changes. So, day by day. And yeah, despite everything that we're hearing, the day-to-day wins are so important. So it's good to kind of like remember those and hold them close. To kind of feed us as we move forward. But, you're already here, you're in this Zoom. So it seems like that, you have kind of found something. So good luck. Yeah, and same as everyone else, like I'm very, willing if anyone's interested in maternal health, maternal mental health, just send me a message. Yeah. Thanks so much, everyone.
Thank you also.
Elena, can I add one more thing?
Oh, please.
I know a lot of students may be concerned about going to work and going to school at the same time. I did my MPH and I worked full time, and I'm doing my PhD and I'm working full time. I have full-time bills, so that's why I'm working full time and I'm making it work. So it's possible. You just got to really work on time management. So don't discount that if you're concerned about working and going to school. It's definitely doable. You just have to really organize yourself and be committed to the cause.
Thank you. So, on behalf of CUNY SPH and the Office of Career Services, we want to thank everyone for coming out tonight. We hope that this panel was insightful and encouraging. Please visit the Career Services website to learn more about the resources available for CUNY SPH students and alumni. Staff will be in the main Zoom room for a few minutes if you have any questions, and you're also going to receive a post-event email tomorrow with the panel recordings and a contact info sheet so you can directly connect with our panelists. Don't forget to complete the brief feedback survey that will pop up once you leave the meeting. Good night. Thank you.
Thank you.
Thank you so much.